let's go over to you at Servicenow. And you gave an example, or you mentioned that you're working with the VA. Give us a specific example of a program that you've been working on that's been perhaps wildly successful.
So I'll give you one of the things I wanted to share was the fact that we work with the state of Washington, and we're starting to work more with the VA now, but I don't have a specific example for you. But we worked with the state of Washington when COVID first struck, and we built these applications over the course of 3 days. And really it was emergency response and assigning staff and resources to support the emergency, COVID being COVID, distributing information, so emergency outreach, self-reporting so that employees could say, hey, I feel sick, I'm not really ready to return to work, and somehow notifying their managers, of their illness, and then emergency exposure management. So this is where they're identifying and managing exposure risk so that they don't expose their patients or other staff members. We deployed those applications in March, and then we piggybacked on those applications and built 6 more so that to release to our customers. And what we found during this time period was our customers wanted, like Jose mentioned, some more dashboards and analytics so that they can track some of the trends and kind of isolate some of those cases. Workplace safety was another application that we rolled out. PPE inventory. We worked with a number of hospitals that were trying to track some of the, PPE equipment that were, you can remember it was just scarce, right? So now doctors and clinicians can check in and check out inventory. In addition to employees that are starting to transition back into the workplace, they can, be assigned, PPE equipment. Contact tracing. We started this, for one of our, private sector companies, and what they wanted to do was try to figure out or pinpoint who was in the meeting rooms together. How can we isolate that group and keep those folks at home so that they do not spread the virus to other members of their team? And then the last application was facilities management. Where do we need to go and sterilize and clean? Which rooms, may have, caused some of this illness to spread? And so we can kind of deploy the crew to go and clean these rooms. So yeah, these applications were built, as I mentioned, over the course of 3 days. And then we had, a Tiger team building these additional applications for other hospitals that we support in the private sector.
Outstanding.